main objectives that I want everybody to take away from this is basically to understand the basic principles of first aid. There are several health benefits to practicing Taekwondo. It improves strength, flexibility, cardiac health. It helps to decrease your risk for chronic injuries and illnesses, heart disease, diabetes. It can help improve your mood, releasing the endorphins, brighten things up. However, unfortunately, there's always the risk of experiencing or having to deal with some kind of an injury when you're on the mat. Basic principles of first aid include making sure to keep yourself calm and making sure that you assess the situation quickly and accurately. Want to make sure to protect yourself from danger as well as to protect the person. For example, if you are in a situation where perhaps the area was wet, somebody slipped and fell, you wouldn't want to rush over there. You might risk slipping and falling yourself. Or if you were in an area where maybe there was some kind of environmental hazard, some kind of broken glass, your first thing is to help keep yourself and the people around you safe. You also want to make sure to prevent the spread of any kind of infection. One of the philosophies that we always utilize is the universal precautions, which essentially means to treat all body fluids as being contaminated. It's important to make sure that you're using appropriate hand hygiene, either washing your hands with soap and water or using an alcohol-based antibacterial scrub, and make sure that you don gloves before you treat the person. You want to make sure that you are able to recognize those situations and arrange for 911 emergency care in case that's needed. So a few of the most common injuries: cuts and scrapes, bleeding to the nose or bleeding to the mouth, bumps, bruises, sprains and strains, soft tissue injuries, a feeling of having the wind knocked out of you. As far as cuts and scrapes, though, most of us are able to recognize those when we see them. Want to make sure to hold light pressure to the wound to help control the bleeding, utilizing a cotton gauze. We want to make sure to cleanse the wound with a saline or wound cleansing solution. We can apply a little antibiotic ointment if it's available. Opportunities that you might need to seek medical intervention would be if the wound is very deep, at least a quarter of an inch thick. If the wound has any kind of jagged edges, if there's any kind of exposed yellow or reddish muscle or fat-looking tissue, or if the wound is stabilized and then later becomes infected, redness, pus, swelling, you would still need to make sure to follow up with appropriate medical services. And then in case of bleeding from the nose or the mouth, once again, we do want to make sure that we don our protective equipment, keep ourselves safe. You want to apply pressure, usually for several minutes. Anything above the level of heart is going to bleed more profusely because of the way your circulation works. Your heart pumps from top to bottom, as well as from the heart down up to your toes. Everything up here is going to be bleeding a little bit. So we want to make sure that we apply pressure. If it happens to be a cut to the lip, you can use a little gauze and you can hold pressure for a few minutes, and that should help the bleeding under control. You can also apply an ice pack, a little cold compress, to help to promote the vasoconstriction where the blood vessels constrict to help slow down the breathing. If you have a situation where somebody is bleeding from the nose, we want to make sure to hold pressure to the nostrils to pinch, and we want to make sure that we're looking down to prevent the spread of to prevent anything from kind of trickling down into the back of the throat. Sometimes you'll see people looking up, but that will allow the blood to drift back and that'll cause an irritation. So instead, we want to make sure to pinch it, go forward, apply pressure for a few minutes. If the bleeding does continue for a few minutes, you can also go ahead and apply the cold compress once again to promote the vasoconstriction. And times when you might need to seek medical treatment would be if there's any kind of notable deformity, if the septum is deviated, might suggest that the nose be broken. If there's any kind of dental involvement, a tooth is knocked loose or knocked out, then absolutely want to make sure to seek medical attention. Some kind of a blow, usually to the diaphragm, and it causes a feeling like you're not able to breathe, not able to catch your breath. And it does feel really scary when it happens, but it's typically a very short-lived experience, usually only lasts for a couple of minutes. As far as treatment goes, we want to make sure that we're loosening any restrictive clothing, removing any pad or any gear, if we're wearing anything on the abdomen. Want to make sure to help guide the person to take slow, deep breaths in through the nose, out through the mouth. Sometimes even doing things like flexing the hips, putting your hands on top of your head can help to straighten up the diaphragm, help to make the breathing feel a little bit easier. Then, of course, if there's ever an issue where the person is very, very short of breath, has problem with oxygenation, for example, at the nail bed, so the lips look like they're starting to turn blue. If they have severe symptoms, we want to make sure that we seek medical attention. Head injuries are one of the more potentially severe situations that you might run into on the mat. They do range from a level of being pretty mild to being pretty severe. Are they alert? We want to make sure that we can identify that. Is there any obvious bumps, bruising, or a little compression to kind of help support the neck? As far as treatment goes, if it's a pretty mild injury, you can usually just have the person sit down, take a little breath, apply an ice pack if there's any kind of like a little bump that's formed. If there's any kind of a cut, make sure that we're applying pressure like we had talked about before. Make sure to monitor for their breathing, make sure to monitor for exacerbation of pain or symptoms, and seek medical attention in a severe event where the person loses consciousness, the person is dizzy, disoriented, can't state their name, where they're at. If there's any vomiting, nausea, if there is any seizure type activity, any convulsions, if there's any sign of a potential skull fracture, leaching from the ears, those are absolutely non-medical emergencies. Stabilize as much as you can. Chronic conditions, sometimes people join martial arts when they are trying to help control something like asthma, diabetes, so that way they can develop more physical strength, that way they can improve use of their lungs, things with their heart. So it's really beneficial for folks who are struggling with different health conditions. So we do need to make sure that we are sensitive to those folks who come on the mat, especially if they do have any kind of history of asthma, of diabetes, hypertension, if they have any kind of heart conditions. Sometimes we'll even see episodes of behavioral issues where we have somebody who is struggling to respond with anger, depression, anxiety. So we want to make sure that we're prepared to handle that. In the event of an asthma attack, you'll usually recognize symptoms such as breathing quickly, having a hard time catching their breath, feeling a tightness or feeling a pain to the chest area. Sometimes you'll even hear audible wheezing, which is a little bit like a high-pitched noise that kind of comes out either during inspiration, expiration. So it'll be kind of like a high-pitched squeaking noise. Sometimes you'll have, a cough that's difficult to control. So for any of these kinds of symptoms, you want to make sure that you have the person sitting up instead of laying flat on their back, because as they're sitting up, it helps to keep the diaphragm, keep everything up nice and straight and give them a little bit more structure and support. They do instruct them through taking slow and deep, even breaths. If they do have an emergency medication like an inhaler, allow the person, of course, to use their inhaler. And of course, if the symptoms don't resolve, 911 emergency, make sure to seek medical attention. And it's, please do not leave the person on their own. Please make sure that you stay with that person until we can get the situation under control or until help arrives, okay? As far as diabetes, we do have a lot of diabetes in the Valley. So some of the symptoms that you might see are episodes of very low or very high blood sugar. If you've got somebody on the mat, say maybe they haven't eaten very much today, they are, not feeling a little under the weather. So those are indications that we can check the glucose. If people now are wearing continuous glucose monitors, if the blood sugar is running a little low, treatment involves just 15 grams of rapid carbohydrates, for example, 4 ounces of juice, a couple of little glucose tablets. Wait about 15-30 minutes for the body to utilize that carbohydrate, and the sugar will come up on their own. We tell people that when they're having those low events, for the most part, you're a couple sips of juice away from feeling better. Try to prevent them in the future by making sure that you're well hydrated. Those events where the blood sugar is running high, we often will see symptoms such as feeling very dry mouth, feeling very thirsty, feeling like you need to use the restroom a lot, and it just, no matter how much you drink, it just doesn't satisfy you. Sometimes you'll even notice like a sweet or a free sense on breath. So that's when we start to consider high blood sugar levels. Possibly the person might have some kind of a flu or an infection, some kind of an illness. It's close enough to lunchtime that they can take their lunchtime mealtime insulin. Do you allow the person to rest, drink their water? If there's any dizziness, a parent or guardian, so that way they can come and assess the situation. Or events can become very severe, so it's important to try to recognize those signs and symptoms and intervene early. Seizures, there are lots of different kinds of seizures that can look a little bit different. So some of the most classic or obvious are going to be the tonic-clonic. They're basically an interruption in the spinal neurons, and it results in very quick muscle contraction, so you'll notice shaking. Sometimes you'll have minor, little, like less obvious symptoms. Sometimes blank stare, drooling in the side of the mouth. These are more like the petit mal type seizures, where they still have an interruption of that flow, but they don't show the classic convulsion signs that you might be expecting. Sometimes as chest muscles tighten, they might let out a scream or something to that effect. If they fall to the ground, we want to make sure that we give them that little bit of space. It's common especially for, kiddos to run forward. The victim is, what's happening? But as much as we can, try to control the situation, try to keep the person safe. Make sure if there's any chairs or anything that are around the person, make sure to move those aside. Make sure to avoid putting anything in the person's mouth. If you put something in the person's mouth, they could write down, they could bite it, and it could wind up with a lot of trouble. If be possible, try to time the seizure and, when did it start, what kind of symptoms were showing. So those kinds of symptoms can be reported to the medical professional, to the parent, to a child's guardian. Please make sure that you do not hold that person down. Just keep the area around them nice and clear, like they've got a nice little cushion or a nice little bubble, okay? Sometimes it also is helpful to explain what's happening to the others around. It's just a little seizure type episode. We're going to have you kids move over here. We're going to have this person here just to control the classroom situation to help keep your students and help keep everybody safe. And of course, they do have any kind of a seizure, the child, make sure you go back to parent. If they're having an episode where the seizure is lasting for more than a minute or 2, 3 minutes, then we're also starting to worry about, something like a static. So you do need to make sure that you call 911 so that way they can come and take care of and stabilize the patient, okay? And try to recognize signs and symptoms early so that way we can prevent, exacerbations. But if you ever have anybody who is, say, complaining of a very tightness to the chest, having pain shooting up and down the arm or radiating toward the back, having sometimes things such as cold sweats, throwing up, or feeling very nauseous, indigestion, this feeling of just dreaded anxiety, impending doom, emergency situation. So call 911. If for any reason the person does fall unconscious, move people aside. We're assessing the ABCs for airway, breathing, and circulation. We're making sure to put our ear close enough that we can listen for breathing. We can watch for moving up the chest, feeling for the heart rate, even right here on the little carotid. If you were to put your hand here, you feel the little beating, dum-dum-dum. But if you have a person who doesn't have a heart rate, who's not breathing, then one of the things that we've started to do now is the compression-only CPR, essentially to help start up the heart. So this is something that you would basically lace your fingers together just above the little breastbone, and they would just press down at a rate of about 120 compressions a minute. Usually it's better if you have some kind of a little bit of training or experience or practice with these kinds of events. So there are a lot of classes that you are able to sign up for online as well as in person. So that way you can kind of practice these skills if there was something that you were interested through. The American Heart Association has a really good program. If you do have an AED available, an AED is an automatic electronic defibrillator device. It's eventually, maybe you've seen it on the TV shows where get the AED and they'll attach little pads to the chest, and the device will analyze the heart rhythm, and it'll prompt you whether or not a shock is needed or not. If it does need a shock, it'll tell you, you just clear the area. If it doesn't, it'll just say continue with compressions, and you would continue to do so. And you want to call 911. Even if you know how to do CPR, the first step that they teach you there is check the scene, check the victim, awake, alert, are you okay? Get the AED, call 911, start with the compressions. If they arrive, they'll be able to take over and get the person to the hospital for the emergency care. Preventing injuries, we want to make sure that we are monitoring the class frequently. We're walking around to check on our students. We're going to pay attention to any health needs that the students might have. Especially if you have a new student coming into class, let them know, hey, we're here to keep safe. Is there any health conditions, anything that we need to know about? Because we want you to stay safe with us on the mat. So make it like an open, friendly type environment where you're able to assess their needs. While you're watching the class, keep in mind that there may be some folks who have issues like that's going to make it harder for them to do some of the activities, maybe limited flexibility, maybe advanced age, maybe being very young, maybe having some kind of a history of an injury to the shoulder. We're going to make sure that we are giving everybody a chance to stretch, a chance to work out a little bit at the beginning to prevent injuries. If you go to hard exercise without warming up, then it does increase the risk for injuries on the mat, pulls and strains especially. So also important to make sure that we're wearing appropriate clothing on the mat. We should have clothes that are fitting comfortably, the pants that are not too long that we're tripping over them. Make sure that the belt is being worn appropriately on the waist, tied securely, so that way it doesn't fall off and work as a tripping hazard. So constantly supervising and checking on that, making sure that you all are safe and ready to practice. So it's important for everybody to practice safety, whether we're students, whether we're teachers, whether we're bystanders. We always want to try to promote a safe environment in the classroom. Cotton gauzes of different sizes, just to make sure that we have a way we can use the right size for the right size injury, or you can hold pressure to those wounds. Make sure that you have your gloves and your alcohol, to cleanse your hands. Make sure that you have some kind of like a first aid ointment. It's nice to have available. You can use that to protect and keep the wound safe. Band-aids of different sizes, different shapes. We have big bandages, we have small bandages, we have butterfly closures, we have steri strips. So we've got a lot of different shapes and sizes. It's also important to make sure that you've got some kinds of like ACE wraps available, the elastic wraps. I tend to shy away from using the sports tape, the one that's inflexible, because normally when you're going to be utilizing something like that, you're taking medication available like children's Tylenol, Benadryl, aspirin, just in case. Adults are able usually to use some special equipment that you might consider also involve having a little pen light. It's like a little tiny flashlight that you can use to look at the ears, the eyes, the nose, and give it a little extra light. A lot of us have cell phones now that have a flashlight function that also can kind of help. Blood pressure cuff, thermometers, glucometers, stethoscopes, all super fun equipment that you can also have inside your first aid kit. So that way you can have an even more in-depth, assessment. Usually works better if you know how to use those devices. So that way you can make sure that we are utilizing them appropriately. It is really important to make sure you have a well-stocked first aid kit just in case you ever run into any kind of situation on the mat. So now we're going to take a little time to show a couple of scenarios of injuries or events that might need your attention. In the event where somebody gets kicked in the nose, don our gloves, make sure that we're not touching the outside of the gloves, so you can usually just hold it from the inside bits. We donned our gloves, assess the situation. Fernando, can you tell me how you're feeling? Can you tell me what happened?
Smacked in my nose, and next thing you know it, a lot of blood's coming out.
All right, no dizziness, no swelling, nothing like that. I'm going to go ahead and use a little gauze to put pressure on your nose. We're going to make sure to pinch your nares. I need you to look down for me, please. So I'm going to hold gentle pressure and until you start to feel like your nose doesn't feel wet or slick from the inside. Check your nose, make sure that there is further. They got that done. Everything is looking fine. The situation that we might be facing is if somebody has an injury to their wrist area. Can you tell me what happened? What's going on?
I was breaking some boards. I think I hit it wrong.
Okay.
It just hurts.
Can you go ahead and remove your hand so I can go ahead and assess the area?
Okay.
Okay. Here, more pain or less pain?
Oh, and that's okay.
From here, more pain or less pain?
Just minutes.
So it just feels bad right here. Okay. Let me go ahead and painted nails. Make sure those nails are looking good. I can still see a little bit of your nail bed. Checking to make sure that you don't have any bluing or discoloration. Are you able to move your wrist at all?
Handful. Yeah.
Are you able to make a fist? It's a little bit tender when you're closing your fingers. Can you open your fingers for me? Can you squeeze my fingers?
I guess that's your starting.
Okay. Can you squeeze my fingers with your other hand as well?
Yeah. Put this one in close.
Oh yeah, no problems there. Okay. So we're going to go ahead and stabilize it with a little compression and apply a little ice pack, and that should help you feel better. So when we're wrapping up any kind of a wrist, we want to make sure that we have a medium level of compression. Too loose, it's going to fall off. Too tight, it's going to restrict the circulation. So we can gently wrap all the way up. And we'll go ahead and grab one of our little ice packs, break it open, up. You can go ahead and hold gentle pressure here for a little bit. Are you able to put your hand up here? Kind of hold it a little bit above the heart. We have your hand for a second here. Like hold it this way.
Hey.
You gently walk right.
Can do that.
Careful here, we're going to rotate. We're going to have you slowly sit down. All right. Can you tell me what happened?
I was just running and I just twisted my ankle and it swallowed and it hurts.
Okay, did you fall down or did you lose your balance?
Lose my balance.
Lose your balance. You're going to go ahead and roll up your pants leg. You're going to go ahead and assess. I'm going to raise your foot. Let me know if there's any pain or discomfort here. And we're assessing right there. We're assessing for redness. We're assessing for bruising. We're assessing for swelling. Are you able to wiggle your toes? Yes. Very good. I'm going to press down on your nail beds. I'm going to look to make sure there's no discoloration. Even underneath your red fingernails, you can still see the little tiny bit of your nail bed. All right. Are you able to flex your foot up and down?
But it hurts.
It hurts when you do.
Yes.
Are you able to move your foot to the side? The side?
Still hurts.
Still hurts. More pain or less pain?
More pain.
More pain when you're coming toward me? Or less pain away from me?
Towards you.
So we're going to go ahead and going to wrap up our ankle, give it a little extra support. We're going to go ahead and apply an ice pack to help to prevent and to decrease some of the swelling. So we're going to go ahead and wrap it not too loose, not too tight. We want to make sure that we're supporting the arches, supporting our ankles. And then we're going to go ahead and also have you rest your foot here on this chair. It's a little bit cold. Okay. And then we're going to go ahead and have your ice pack. Make it up. And I go ahead and hold that very gently for a few minutes so we start to feel better. We might have a student who's feeling a lot of anxiety. Maybe they're under pressure during a test. Maybe something's not going their way. So when you have a student who's feeling anxious, you might be recognizing or looking for symptoms such as maybe clenching their fists, maybe breathing quickly, breathing hard.
Hey, Sarah, can you tell me what's going on? Well, I stand to this knowing the kid and will come and detect my cat stuff.
Okay, so let's go ahead and try to take a couple of things to come down. We're going to go ahead and take a few deep breaths in through our nose and in through our mouth. Are you able to come and sit down on the chair with me here? All right, let's go ahead and have a little seat. All right, in through your nose and out through your mouth. Through the face. You're doing a really great job with your deep breathing techniques. How are you feeling now? Okay, does anything hurt you? Does anything bother you? You feel like you're ready to come and join?